Good morning, Mr. Wilson. Great to see you again. How you feeling?
Hey, feeling good. Thank you very much, Karen. How are you today?
I'm great. So I'm so excited that this telemedicine experience really worked in your favor. Can you tell me a little bit about what your thoughts are, your feelings, and how things went for you? I guess the interesting part of your story is that we first met over telemedicine. You didn't come into the office to see us, so.
No, actually, this was my first experience with telemedicine, and it was needless to say, when we first heard that we were going to do this, it was a little bit nerve-wracking from a standpoint of never participating in this before. But we took some steps prior to meeting with you online. Wrote down the questions that we felt that we would have, and of course follow-up questions based upon answers that we got from you. We had never met you. We had never met Dr. George, who did my surgery. But overall, it was surprisingly a very pleasant experience. And I say surprisingly because, here again, it was the unknown, which we dealt a lot with lately.
Yeah, I think especially during this COVID pandemic, it's been a really trying time for our patients, not quite feeling safe or comfortable into coming into a hospital or medical clinic setting. So offering telemedicine services has been really fantastic on our part, but it's great to hear from your side that it went so well, especially, thinking about having a surgery, and that's a big deal as well. We really want to keep our patients' safety in mind, to keep our staff safe, so telemedicine has been a great option for us to utilize.
No, it was an excellent experience for us. Like I said, it was new. We were a little nervous because, needless to say, under the circumstances that we have today, no one was allowed to be in the hospital with me, and I was there from a Friday until a Monday by myself. However, the staff overall was great at making sure that my wife was included in all of the FaceTime experience that I had in the hospital, as well as prior to and post as well. It gave us both a little bit of comfort to know that she was getting the same communications that I was getting, and helped us pre-surgery, helped us while I was in the hospital, and also helped us post-surgery in going through everything. As I said, it was a little nerve-wracking because it was something new and different we had never done before, but I commend the staff for leading us through that and helping us be comfortable throughout the whole process.
Well, I'm just so happy it worked so well for you. MUSC and the colorectal surgery department are really happy that patients are embracing this new technology and service that we're offering. So thank you so much, and I'm so glad you had a great surgical experience.
Well, thank you very much. I'm very, very well on the mend, and appreciate everything that you and your team did for me.
Great. Thanks so much.